Hello everyone, my name is Vivian Williams, and today I'm going to be sharing with you my capstone project that I completed at Harding Hospital, looking at interventions preventing readmission to psychiatric inpatient care. So here's my overall poster I created based on my experience, including my scoping review, my overall capstone experience, and my capstone project specifically. So Harding Hospital is a part of Ohio State's Wexner Medical Center that serves adult patients with a variety of psychiatric illnesses. Programs at Harding include inpatient and outpatient services, but occupational therapy is provided only in the inpatient setting for treatment of all appropriate inpatients on various floors. And while at Harding, my role was to work on knowledge translation for increased evidence-based practice, clinical practice in building my skills with the patients, and professional development in seeking out other trainings and experiences. So while at Harding, I was implementing research based on the scoping review to answer the question, what interventions support community reintegration for adults with serious mental illness after a psychiatric hospital stay? 15 studies were included in the scoping review, 8 intervention studies, and 7 descriptive studies. And the results were that overall, the most important pieces to community reintegration intervention involve a pre- and post-discharge aspect, promote independence and meaningful occupations, connect patients to outpatient care, and plan for possible obstacles to attending appointments. So based on this study, I completed a case report or modified client report with a patient. Patient was a 53-year-old female with major depressive disorder and post-traumatic stress disorder who was admitted with suicidal ideation due to trauma and mental health decompensation. She also had been previously hospitalized and was currently neglecting her ADLs and IDLs. The OT interventions that were provided for the patient included behavioral activation, scheduling, medication management, intervention to make a discharge obstacle plan, and incorporating coping skills as well as self-care into her daily routine, with a plan to do that inside the hospital and outside the hospital. As well, she had social work and medical team interventions for determining most effective medications and connecting her to outpatient care. So the results of the interventions included that she had increased coping skill use, improved sleep hygiene, increased participation in self-care, minimum to modest to create daily schedule, and ability to state 2 out of 10 reasons to live. And these indicate that she made progress but had a continued need for a higher level of care. We also wanted to look at attendance to outpatient programs, as attending outpatient care is a large indicator for whether a patient will be readmitted or not. She was recommended to go to the partial hospitalization program as part of Harding's programming, and she did miss her first appointment due to oversleeping, however, maintained attendance through the remainder of the PHP as well as the intensive outpatient program. Further, she has not been readmitted since her time at Harding, but in order for this to be a more comprehensive measure, we would need to look at it over a 1 to 2 year period span, as this is a more common pattern of readmittance for the patient. So the recommendations are to keep implementing this modified algorithm as it is shown and as it was created based off the research, including OT interventions to increase independence in ADLs and IDLs, for scheduling and planning daily activities, for medication management, and to address obstacles for discharge and make a plan and build skills that patients can use once they are discharged. As well, continued collaboration with social work and the medical team to connect the patient to outpatient services is important. So when it comes to working with the interdisciplinary team, I had some experiences at Harding. I was able to attend interdisciplinary rounds on each of the various floors throughout my time, spending a week on each floor. And this was a very valuable experience, as OT is not currently attending rounds due to limited staffing and limited time to do so. But during this time, I was able to advocate for OT, be a voice for them in their role, and teach many people on the interdisciplinary team what OT offers patients and how they can use our services more. I was also able to recommend some ways for occupational therapy to bridge the gap in communication between themselves and the rest of the team. As you can see in the middle, this is the overall continuum of care offered at Harding for psychiatric services. I was able to see a lot of these experiences. The first one, the crisis management and acute inpatient care, I obviously saw during my time at inpatient in Harding. I was able to have extra experiences with the social work team there by attending their groups and leading some groups, as well as seeing their one-on-one sessions with patients in the inpatient setting. I was also able to shadow the partial hospitalization program, as well as the outpatient program of behavioral health immediate care, both offered at Harding. during my time. The Behavioral Health Immediate Care is an important program that bridges the gap between inpatient and outpatient services for our patients and fills a role that was found in research that describes a post-discharge contact being necessary for decreased readmission. I was also able to spend a day at Talbot's partial hospitalization program, which is the drug and alcohol addiction treatment services. In each of these experiences, I was able to come back and share what I learned with the OT team. Finally, I created some resources, such as the one seen here, for the occupational therapists at Harding to use in their treatment with patients to increase evidence-based practice. And I was also able to compile many resources and literature into a OneDrive account for all of the OT practitioners to use who are working at Harding. This made an easily accessible resource that makes sure that nothing is lost and everything is where it needs to be, as well as I was able to add treatments and interventions in areas that were not being addressed. So overall, that is my project. If you have any questions about it, let me know and I would be glad to answer.